Hi, my name is Kelly Stagg. I'm a speech pathologist and lecturer at the La Trobe Rural Health School. When you think of speech pathology, your first thoughts might be of a young child with speech sound problems or perhaps a stutter, but speech pathology is actually a very broad profession. I often say to people considering studying speech pathology that one of the best things about the profession is the diverse career opportunities. No two speech pathologists do the same thing. Every day we work with people on individualised goals and therapies. For example, you'll find speech pathologists working with classroom teachers on language and literacy skills, making recommendations on food and fluids that can be swallowed safely after stroke, or working with someone with a disability and their family to have conversations in the community. Speech pathologists typically work as part of a multidisciplinary team and work in a wide range of settings, including hospitals, rehabilitation centres, schools, private practice and aged care settings, and that's just to name a few. We do important and rewarding work that improves the lives of the people we work with. Take a moment to think about how and what you've communicated to others today. You've probably messaged a friend, maybe used social media. Perhaps you've told someone about your plans for the weekend or shared something funny that happened at school or at work. Regardless of the conversations you've had, you've used communication to build your relationships with others and to express who you are, to share something about yourself. Now imagine if you were not able to write or speak, or if those tasks were difficult for you. People with communication impairment tell us that the experience is isolating and alienating. As speech pathologists, we have the opportunity to work with people to maximise their communication and swallowing at all stages of their life. At La Trobe, we offer two pathways to a qualification in speech pathology and practice as a speech pathologist. The Master of Speech Pathology for those who have a prior degree and the Bachelor of Speech Pathology with honours. In both courses, you will learn to diagnose, treat and manage communication and swallowing problems through small group work, practical skills classes, simulations, lectures and online learning. We focus on learning through real-world, authentic cases that will help you to build your problem-solving, critical thinking and communication skills. External clinical placements are a key component of your training. Clinical placements involve honing your clinical skills while working with a practicing speech pathologist in a clinical setting. Our clinical placements are throughout rural and regional Victoria. There's also the opportunity to volunteer for placements in remote communities or to apply for overseas experiences. The key features of this new 4-year course are the new speech pathology specific subjects in first year, clinical placement subjects from second year onwards, embedded industry relevant knowledge and employability skills, and the embedded honours program that enables students to work collaboratively with industry to solve real world problems and to answer important research questions. There are many benefits to studying speech pathology with us here at the La Trobe Rural Health School in Bendigo. I'm going to give you my top 5 now. Number 1, you get to live in the beautiful regional city of Bendigo and study in new purpose-built facilities, including our clinical teaching building on the Bendigo Hospital site. This allows students to easily move between clinical learning environments and theory classes. Number 2, you will work with a team of experienced lecturers in Bendigo who are experts in a range of areas of speech pathology practice. Our lecturers are all active in research and will share findings from their own research with you. Number 3, classes are small, so you will quickly get to know the other students in your course. Students move here to study with us from throughout Victoria and beyond, so we find that our students are keen to meet new people and make new friends, and close support networks form very quickly. Your lecturers also get to know you quickly, and this helps us in supporting you to succeed. If you're from rural and regional Victoria, this may mean allocating at least one of your clinical placements close to your hometown. Number 4, along with the competencies you need to work as a speech pathologist anywhere in Australia, your training will provide you with additional knowledge and skills in rural and regional practice. This adds to your employability. Number 5, La Trobe is the longest standing provider of speech pathology training in Victoria. Because lecturers here in Bendigo work collaboratively with staff from the Melbourne campus, you have all of the benefits of studying on a regional campus, along with the knowledge that the curriculum was developed by a large pool of experts who know what you need to succeed as a speech pathologist when you graduate. Come and study with us.
Hi, my name's Victoria. I'm a speech pathologist and I graduated from the speech pathology degree at La Trobe University in Bendigo in 2019. The course prepared me for my career as a speech pathologist through my clinical placements. I had the opportunity to gain hands-on experience in a range of different areas of practice, including the hospital, through acute and rehab, aged care, schools, and community health centres as well. Working as a speech pathologist now is really exciting. I get to help people who have difficulty with swallowing in the hospital and help them get back to eating and drinking the things they love. My current role is on the acute wards at Bendigo Health. I'm working in a large multidisciplinary team. We work with people on their swallowing to help them to manage while they're in hospital, as well as their communication and making sure they can communicate with the doctors and the nurses and also get back to doing the things that they really want to do when they leave. I also have experience working in private practice in the NDIS space. I was working with children with disability, primarily autism spectrum disorder, intellectual disability and Down syndrome. I was helping them with their speech, language, and also their social communication skills and helping them to participate at school and in the community. Graduates from my cohort are working across the state. Lots have gone back to their hometowns and working in a whole range of different areas in paediatrics and adults, and some have gone into research as well.